Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Do you know what causes typhoid fever? This is a question that may not cross our minds often, but it's an important one. Typhoid fever is a serious, potentially fatal disease instigated by the bacterium Salmonella typhi. It doesn't just appear out of nowhere. It's primarily contracted through contaminated food or water. Yes, something as simple as the water you drink or the food you eat can lead to such a severe condition. Understanding the causes of typhoid fever is the first step to preventing it. Typhoid fever is a bacterial infection, but how does it enter our bodies? The perpetrator is a bacterium known as Salmonella typhi. This microscopic villain is quite crafty and uses common elements like food and water as its vehicles to infect humans. It spreads when an infected person, who may not even know they're carrying the bacteria, handles food or water. If this food or water is then consumed by another person, the bacteria make their way into a new host. Poor sanitation and hygiene practices, such as not washing hands thoroughly or consuming untreated water, can significantly increase the risk of infection. In fact, areas with inadequate sewage and water treatment are often hotspots for typhoid fever. So it's not the food and water themselves that are harmful, but rather the invisible bacteria they can carry when not properly cleaned or cooked. So, as you can see, the main culprits behind the spread of typhoid are contaminated food and water. So, how would you know if you or someone else has contracted typhoid fever? Well, the signs and symptoms of typhoid fever can be quite varied. They can range from mild to severe, and they may appear gradually or suddenly. The onset of the disease is often marked by a persistent high fever, typically hovering around 104 degrees Fahrenheit. This fever is often accompanied by a headache and a general feeling of malaise. Next, abdominal pain is a common symptom. It can be a dull discomfort or a sharp cramping sensation. Alongside this, digestive disturbances may occur. Some individuals may experience constipation, while others could suffer from diarrhea. Moreover, fatigue, weakness, and loss of appetite are other telltale indications of typhoid fever. The severity of these symptoms often depends on the speed and effectiveness of the treatment administered. Always remember, early detection of these symptoms can lead to quicker treatment and recovery. Suspecting typhoid is one thing, confirming it is another. How do doctors diagnose and treat typhoid fever? When typhoid fever is suspected, doctors often turn to a series of tests. A blood test is typically the first step. This can help identify the presence of Salmonella typhi bacteria, the culprit behind typhoid fever. But the bacteria might not always show up in a blood test, particularly in the early stages of the disease. Stool tests provide another means of diagnosis. They can detect the bacteria and are often used in conjunction with blood tests. Remember, these tests are crucial in determining the right course of treatment. Speaking of treatment, antibiotics are the first line of defense against typhoid fever. They work by killing the Salmonella typhi bacteria. It's important to complete the full course of antibiotics, even if you start to feel better before it's finished. With the right diagnosis and prompt treatment, typhoid fever can be effectively managed. Now that you know how serious typhoid fever can be, you might be wondering, how can you prevent it? Well, I'm here to tell you that it's simpler than you might think. Firstly, practicing good hygiene is paramount. Washing your hands thoroughly with soap and clean water, especially before meals and after using the restroom, can go a long way in preventing the spread of the bacteria that cause typhoid fever. Secondly, when it comes to food and drink, be cautious. Avoid consuming food or drinks from street vendors where hygiene standards may not be up to par. If you're traveling, remember to stick to bottled or boiled water, and avoid ice, which may have been made with contaminated water. Next, let's talk about vaccination. There are vaccines available that can provide protection against typhoid fever, especially for those traveling to areas where the disease is common. Consult with your healthcare provider to determine if vaccination is right for you. Lastly, the importance of clean water and sanitation can't be overstated. Many cases of typhoid fever are due to contaminated water sources. Advocating for and supporting clean water initiatives in your community and around the world is crucial in preventing the spread of this disease. Prevention is always better than cure. Stay safe and remember the information shared in this video to protect yourself and others from typhoid fever. UMCC, your ultimate medical consultant connectors.